Assalamu alaikum doctors. So in this video I am discussing a clinical examinations. I enter into the room, examiner telling do the musculoskeletal examination of the child. So that is my command. I wash my hand introducing hello, I am Dr. Ima, one of the doctor in this hospital. I am taking permission from the mother. Hello madam, I want to examine, suppose she is Lima. Lima is muscle joint and bone pain. Is that okay with you? Okay. Then after that, I am asking the screening questions. Do you have any pain in the muscle, bone, or joint pain? Number one. Number two, do you have any problem in going to upstairs and downstairs? And number three, do you have any problem in dressing, undressing, buttoning, and unbuttoning? So these are the screening question three I ask. Okay. After asking these questions, I look at the child, any distress, dysmorphic features, device attached, child general condition. So I find the child is very tall and thin and wearing glasses. It also from the beginning, this impression giving it is going to be Marfan. Okay, then I tell him, can you please stand? So he stand. First, any shoes or any socks, anything, it will be removed. Then the child will be exposed from mid thigh, and tell her, can you please stand? So he stand. I will sit and look at his leg nicely. I find there is genu recurvatum. Okay, genu recurvatum, pes planus can be, I find. After that, and then a capulate spot also can I find. So then I am going to the okay, then leg, I am telling I have to see your back. So I see the back, there is, I find scoliosis, even scar mark of scoliosis, repair scar mark. Then I tell the child, can you walking, can you go to the door by normal walking, come back with running. Then I'll show her heel walking and the tipped walking, and she also do that. So after gate, then I will tell look to lie down on the couch. She will be couch on the lie down. So first time measurement by a measuring tape, both limb length discrepancy, there is nothing I find. Then I am going to the inspect the leg. I find these are the long leg, and what I find, the fingers are very long. That is arachnodactyly on the legs also, foot. Okay. Then I tell her bend the leg. Then he look. After that, I patellar tape. I will measure both leg patellar tape. Then I am telling to bend her leg and take it to the abdomen. Right leg, left leg, both I do. Then I the knee joint adduction, abduction, and then internal rotations, both knee I am doing. Then ankle joint dorsiflexion, plantar flexion, eversion, inversion, I show her to do. I do that. Okay, then I'm going to the upper limb. I tell her, can you please sit down? So sit down. Then I again expose the hand up to the shoulder, and limb length discrepancy, both palm together she placed. After that, I show her hand. I'm seeing her hand. I find they have arachnodactyly, long finger. Okay. After that, long finger. So I do the make a star, make a fist, make anti-prayer sign and the prayer sign, and I squeeze the metacarpophalangeal joint. Then on the hand, I understand it is a Marfan syndrome, so I do the positive Steinberg thumb sign and the wrist sign. Both I am doing thumb sign, wrist sign. Then also I do the Byton score, the little finger and the thumb finger. Byton score, extended the hand, elbow joint I am seeing. Then I tell the child, his hand above the head, behind the neck. Then I look at the child face. She's thin and thin face. The face is actually thin. Okay, and I wearing glasses. Then I tell about the neck movement. Right side look at, left side look at. Then touch the right ear to the right shoulder, left ear, left shoulder. Touch the chin to the chest and look at the ceiling. So this movement and three finger inside the mouth. I also want to see the teeth. I find the teeth is overcrowding, and teeth dental abnormality, high arched palate. They have dental and abnormality and high arched palate and thin and long face. Okay. So I'd like to complete my examination by doing the cardiac examinations, because they have murmur present, chest examination, pectus excavatum, pectus carinatum can be expected. I will see the chest and capillate spots or bruises. So I'd like to complete my examination by doing the formal hearing assessment and Byton score for hypermobility. And I would like to ask the other family members with the same condition, because it is an autosomal dominant condition, fibrillar gene chromosome number 15. So after pGAL, what I my presentation today examination Ali Lina is an 11 years age old girl. Through the I do her musculoskeletal examination pGAL. So through the examination I find she is well communicating, not distressed. There is a device wearing glasses, and she looks very tall, thin, and thin face. What I noticed, she is hypermobile. They had the recurvata present, and the child has pes planus if present. I will comment. Capillate spot present, comment. Then I will look at that. I find they have arachnodactyly. There is wrist side, thumb side positive, mitoscore positive, overcrowded teeth, high arched palate, pectus excavatum carinatum, anything present. I will comment. These are so putting together, it is a case of the child is tall in stature, so it is a case of Marfan syndrome. Okay, so how can I manage this condition? So I will revise my note. I will take the history. I will see that what investigation already done or not, and I will involve multidisciplinary team. The tests are I am doing first of all genetic testing, as it is an autosomal dominant condition, fibrillar gene chromosome number 15. Then lab is nothing, X-ray of the spine, because dural ectasia and echo, aortic root dilatation or mitral regurgitation. Remember, aortic root dilatation and mitral regurgitations. Then formal hearing assessment plus slit lamp examination for the eye lens dislocation, upward and the inward. And involve the multidisciplinary team for management. Multidisciplinary team, I am involving my pediatrician, cardiologist, ophthalmologist, occupational physiotherapist, ENT, liaise with the school, psychological support to the family, then thoracic surgeon, pulmonologist. These are geneticists, and I will give some advice. Some advice like they have cardiac disease, so vigorous exercise should be avoided, and muscle strengthening exercise can be done. They have avoid piercing and tattooing. Then regular follow-up. If find chest pain, that is red flag, immediate seek the medical advice. Appropriate footwear they use, because they have, if needed, insole. They use wider pencil because of the grip. So these are the advice. So they can ask the questions like, what are the causes of death in Marfan syndrome? That is spontaneous pneumothorax and dissection of the aorta. So spontaneous pneumothorax and dissection of the aorta is the cause of death in Marfan syndrome. So this is Marfan syndrome musculoskeletal system examination. Thank you.